I'm Dr. Pradeep Kocheeppan from Apollo Hospital, Bangalore. I'm the sports medicine doctor here, and this is an educative video on to what is the treatments for various type of cartilage problems and what is the meaning of cartilage. So this model will try to explain what is the meaning of cartilage. The ends of the bones of the knee joints, both on the thigh bone side and on the leg bone side, is covered by a structure which is called as cartilage, which does not have any blood supply and it does not have any nerve supply. So till cartilage is available, our knees usually will never cause pain. And by the time we start getting constant pain in the knee, it is already significantly late in the disease that your all cartilage is gone. So we have a lot of technologies by which we can restore if your cartilage is treated early. For example, in sports people, those who during sports get a loss of cartilage, we can take cartilage from areas which are not very important and transfer them to these places. These are called as Oates technique. If patient comes with a very large amount of cartilage losses, then such large areas cartilage losses cannot be compensated by transferring, but we have to take a small piece of cartilage, get it cultured outside, and once we get it cultured outside, that cartilage can be put back here, and this particular technology is called as autologous chondrocyte implantation. Then if patients still come later and we find that there is no alignment problem in the leg, that is the leg is having a good alignment, and in such cases if a little more cartilage is gone, we can just take some bone marrow cells and give it a gel, and this particular gel is called as a BMAC technique. So various techniques are available for cartilage restoration. They start from microfracturing, where we make small drill holes in the small area, which works well only when the defect is less than 30 mm, that is 10 mm of cartilage loss. When it is more than 20 mm cartilage loss, we need technologies which are bigger. For example, we use some techniques like Oates technique. Even larger defects like autologous chondrocyte implantation, and late disease we use BMAC technique. Along with cartilage, we have to always see how is the limb alignment, if the hip joint, knee joint and ankle is in one line or not. If the axis is problem, that axis also needs correction. So combining all these techniques becomes a comprehensive treatment for the cartilage.